Hi, everyone. Welcome to the Substance Use Response Working Group Prevention Subcommittee meeting for March 28th, 2024. We are going to start this morning with agenda item number 1, which is a call to order and a roll call to establish quorum. Ms. Rodriguez, can I turn it over to you to establish quorum, please?
Yes. Senator Fabian Doñate?
Here.
Jessica Johnson?
Present.
Debbie Nadler?
Here.
Angela Nichols?
Oh, sorry, here.
And Eric Schoen.
I'm here.
Wonderful. Chair Johnson, we do have a quorum. I did want to note that we are down one subcommittee member. I believe that Senator Titus has replaced Senator Sievers-Gansert on the SURG with Senator Jeff Stone. So we don't know if he'll be on a subcommittee or if he'll be on this one, but I just wanted to note that's why she was not listed as a member today.
Thank you, Ms. Rodriguez, and we thank Senator Sievers-Gansert for the time that she served on our subcommittee here and with the SURG. I appreciate that. With that, let's move on to agenda item number 2, which is public comment.
I have a comment. This is Debbie Nadler for the record, but
One moment, Debbie.
One moment, sorry.
I believe Chair, would you like me to read the slide?
Yes, please.
Okay, so public comment will be received via Zoom by raising your hand or unmuting yourself when asked for public comment. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public under the matter itself, or until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241020. If you are dialing in from a telephone, please dial 669-444-9171. When prompted, enter the meeting ID, which is 825-0031-7472. And please press *9 so that the host can prompt you to unmute.
Wonderful. Thank you, Ms. Rodriguez. Do we have anyone for public comment?
It won't let me raise my hand. This is Debbie Nadler for the record.
Go ahead, Ms. Nadler.
Thank you. I don't know where to begin with this, but I just lost a cousin 2 weeks ago, my first cousin. It is so imperative right now. He was not suffering from a substance use disorder. It was drugs off the street. His brother suffered. He never did. I mean, this is so bad now. These kids don't know about the street drugs. We think they know just because we all know. Nobody else knows. I mean, this has hit home for me now 3 times just this year alone. And it's not getting better. This is getting worse. And if we don't do something preventative, the billboards, the warnings, the schools, it doesn't matter if we yell from the rooftops. They don't know. They don't understand. And it's stemming from mental health. They have some kind of anxiety, some kind of depression, some kind of disorder, and they're turning to drugs and they're turning to street drugs. I mean, I relived my son's death all over again 2 weeks ago. He was in LA and they couldn't find him. And this is just bad. I'm not really doing good myself, just so y'all know. And there's nothing for the family members. I've been seeing a shrink for years and years, and it's not getting better. It's getting worse. I mean, I suffer severe PTSD, and I'm to the point now where I cannot do a lot like I used to do. And then the worst thing is, I'm just making myself open here. I've applied for disability for 5 years and I keep getting denied. And my husband is almost 71 years old. You have to keep.
Question mark.
I'm sorry.
We will see if she reaches back to me for a NOTA meeting today, period.
I'm gonna mute Silver State Government Relations. I don't think they intended to comment.
And
Ms.
so
Nadler,
my point is that all of us who've suffered a loss, we might look normal, but we're not normal on the inside. Believe me, we're not. I tried my hardest for years to overcome my grief and do everything that I can do and fight everything I can fight. But I am so scattered. Emma, thank God, sends me the things every week before I come in and the day before to know. And now I have to go before a judge in 2 weeks, and I get a letter from her telling me if you suffer from substance use, you're not able to be disabled. Well, number one, obviously I don't suffer, but the point of the matter is, what about all the kids suffering? They're not able to get disability. It's a disease. I mean, this is just not fair. Our system's not fair. My husband has to work to support me when he's supposed to retire. And I'm jumping through hoops, and I have to see a judge in New Mexico via phone who doesn't even know me to make a decision for my life. I'm 61 years old. She said I can go work at McDonald's. This is not fair. There's been nothing done. I pay a shrink $300 a visit. Nothing. I paid $48,000 for a funeral. I've sold everything I own to send my son to rehab, and now I have nothing. All this money coming into our state, $1.2 billion, and you don't even care about us. You don't care about the grieving family members. It's not fair. It's not fair, and I'm sorry. I'm not going through a good time right now. I'm sorry.
Ms. Nadler, I can hear that. Thank you for sharing your impassioned story and how deeply this is impacting you and your family. I know this is a period of public comment. I want to know that you have, the support of the committee members here. We've served with you here over the last few years and are here for you. And I agree that we need to find opportunities for action and continued action. And thank you for being honest and being on here to share your story. And I want to invite, if today is not the day to be on this prevention committee, also that if you need to take the time for yourself, you have our permission, to do that as well.
Thank you. I appreciate it. This is terrible. This is not fair.
You're right. It's not fair.
And the last thing is, who do I get in touch with? Because I just need somebody to just finish. This attorney's not doing what she's supposed to be doing, and the disability office is not either here. And I don't even know who to call.
Thank you for sharing your story openly with us today. And I'll offer myself, if you want to chat after today's meeting, I know there are other folks on this call that we can stay connected and help you get those resources and a commitment from our group to address that on this committee.
Thank you. That's it. I'm sorry. I didn't mean to break down. I'm sorry.
Thank you. And if you need to hop off today, I don't think we will lose quorum. So I believe the meeting will be able to continue and do what you need to do also for yourself, Ms. Nadler.
No, I'm going to listen. I just won't talk. Thank you. Thank you.
Do we have anybody else here today for public comment?
Chair Johnson. I do not see anybody else indicating that they wish to provide public comment at this time.
Thank you. With that, I'm going to move on to agenda item number 3, to review and approve the minutes from the October 30th, 2024 Prevention Subcommittee meeting. Hopefully folks had an opportunity to review these minutes, and I'll entertain a motion to approve the minutes.
Chair Johnson, for the record, Eric Schoen, so moved.
Thank you, Mr. Schoen. Do I have a second?
Second.
Is that Senator Doñate?
Yeah.
Thank you. All in favor say aye.
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 Any oppositions? Motion carries to approve the minutes. We'll move on to agenda item number 4, which is the 2024 subcommittee reorientation. Really, today, I think one of our goals is to just make sure that we realign the subcommittee members with the expectations for meeting participation and submitting recommendations. So a few reminders on this front. Beginning this month, so March 2024, attendance will be tracked, and any member that goes below 75% attendance rate for subcommittee meetings or SURG working group meetings will be asked if they wish to continue serving on the SURG. This counts for both excused and unexcused absences. If you cannot attend a meeting, please email the SEI staff at least 4 business days in advance to ensure that a quorum or rescheduling of the meeting can happen if necessary. And please submit this notice for your absence to be counted as an excused absence. Any questions on attendance? All right. Seeing none, I think we can move on to the next piece about the recommendations process.
So Chair Johnson, if it's all right, I can stop sharing the PowerPoint and pull up the survey if that works for you.
That'd be fantastic. Thank you, Ms. Rodriguez.
Chair, would you like me to go through the survey?
That would be fantastic as a reorientation, Ms. Rodriguez. Thank you.
Okay, great. So this is basically the same survey that all the subcommittee members saw last year. It's just been updated with a new link for 2024. So this will be distributed to the subcommittee members following this meeting. So what you do is, I'll have to remove Senator Sievers-Gansert, but you'll find your name, and just for demonstration purposes, I'm going to click on Chair Johnson. I will delete this response. So this obviously is not going to be a real recommendation, but just so everybody can see, this is how it works. So you'll select your name, then you will describe your recommendation. If you have multiple recommendations, you do need to submit a new survey response for each subcommittee recommendation you'd like to submit. You'll describe your justification, any background information. You know, there's been a lot of data, which really helps bolster some of these recommendations. That's where you can put that. If there's any additional research or links that you'd want to include, you can put that under question number 4. And then we get to the questions that align with AB 374, the section 10 requirements. So A, G, and J, those are all the section 10 requirements that were assigned to the prevention subcommittee. And then the next question, which is also about AB 374. These are all cross-cutting elements that were assigned to all three subcommittees. So that encompasses B, C, H, and Q. And so that just helps us track if the SURG is meeting its legislative requirement to meet all of these various efforts. And we can go back to the recommendations and say, oh, we've really only focused on A and not on J. So it's just a way to help track that. That's also true for the special populations. So you can select as many special populations if your recommendation hits multiple, or if it doesn't focus on one, you can select that. If you do know what the action step is, you can note that, as well as if it's a short-term or long-term recommendation. If you know it requires a fiscal note, that's helpful, and especially helpful if you can approximate the amount, but we know that you don't always have that information when you're drafting a recommendation, so you can mark unsure. And then similar to last year, there's just been a reformatting of the questions, but here is where you rate the impact, urgency, capacity and feasibility, and how the recommendation advances racial and health equity. But what's different, because what we heard last year was that this is really subjective, like what's a 3 to somebody might be a 2 to somebody else. And what's really important is that description of why this is urgent. Similar, like how does this advance racial and health equity? So we added those text boxes below so that you can explain it in a little bit more detail. And then finally, it just asks if you have a suggestion for a presenter or a subject matter expert who can provide further details on the recommendation. We do know that sometimes you might not have all of this fleshed out. I know it's a lot of information. However, it is super helpful for getting these recommendations going. If you just have an idea and you're like, I really want to hear from this national expert or this person who's based in Nevada, I want to hear what their recommendations are. I don't necessarily know what the recommendation is. That's fine. You can just email me. And I can work to try to get them to an upcoming prevention subcommittee meeting. So this is really for recommendations. And then at the end, you can say if you want a speaker related to that recommendation, but if you just have a speaker who you want and don't necessarily have all of this fleshed out yet, you can just email me. And then later on, after they present, you could submit something. Any questions on the survey before I go back to the PowerPoint?
Any questions for Ms. Rodriguez? All right, thank you for that clear explanation. I really appreciate it.
All right, can you see the
I can, yes, back to the PowerPoint.
Great. So I should have mentioned that the earlier recommendations are submitted, the more time we have to schedule the presenters and to workshop the recommendations. So it would be great if you're able to submit your ideas as early as possible. That just gives us more time to refine and to get people calendared. And then the other thing that the subcommittee chairs discussed is it would be great to have at least one recommendation from each subcommittee member. Chair Johnson, was there anything else you wanted to say related to the recommendations process?
No, just encouraging subcommittee members to submit at least one recommendation. You have my support to do that as we think through sort of where we want to go this year, which I know we'll talk about in a few more agenda items. So thank you. Any additional questions from subcommittee members about the attendance policy, how to submit a recommendation or suggestion for presenter? All right. Hearing none. Thank you, Ms. Rodriguez and the SEI team for continuing to align the survey for us. With that, we can move on to agenda item number 5. A review of the subpopulations and AB 374 Section 10 requirements that were addressed in the 2023 recommendations. So here I'm going to just review briefly the subcommittee recommendations and how they align across AB 374. And I know that we also have a handout for this item as well. Ms. Rodriguez, do you have more details on this?
Yeah, I just wanted to note that in 2021, it was then Vice Chair Tolles, Dr. Woodard, and Dr. Kearns who determined this subcommittee alignment. And as Chair Johnson noted, there is a full handout that was posted on the SURG website that details all of this. We tried to pull the information on the slides, but if you want to go back or look at anything more closely, I would encourage you to download that from the SURG website. So, Chair, would you like me to review the slides, or do you want to go over them for this part?
I am happy. So I'll do my best, Ms. Rodriguez, and then if there are any details I missed, please fill in those components. So as many of you will recall, as our subcommittee assignment is to look at primary, secondary, and tertiary prevention. So this is reduce the use of substances which are associated with substance use disorders. So to leverage and expand efforts by state and local governmental entities in this capacity, with the ones listed here on the slide. G, to make recommendations to entities, the ones listed here on the slide, including without limitation, to ensure that controlled substances are appropriately prescribed as part of this subcommittee. I'm paraphrasing here, so folks can also follow along on the slide. And then J, to study the efficacy and expand the implementation of programs to 1, educate youth and families about the effects of substance use and substance use disorders, and 2, reduce the harms associated with substance use and substance use disorders while referring persons with substance use disorders to evidence-based treatment. So, and then these next few items are our cross-cutting assignments. So these are ones that are inclusive across our other subcommittees as well. So B, assessing evidence-based strategies for preventing substance use and intervening to stop substance use. And then C, assess and evaluate existing pathways to treatment and recovery across multiple special populations that are outlined in the legislation. And I believe C, is C continued on the next slide, or did those all get included?
I think that was it, unless it got cut off.
All right, thank you. H, which is to examine qualitative and quantitative data to understand the risk factors that contribute to substance use and the rates of substance use and substance use disorders, focusing on the special populations on the aforementioned slide. And Q, to study, evaluate, and make recommendations to the Department of Health and Human Services concerning the use of the money described in Section 10.5 of this Act to address substance use disorders, with a focus on 1 through 5 listed here. And our SEI team prepared this really wonderful summary table of recommendations. Emma, do you want to sort of walk us through how folks can read this?
Sure. And I will give all credit to Margaret, my SCI colleague, who is also on the call today. She made this table. So this is intended to help you see, for the 2023 recommendations, the areas that were selected. So it's just kind of a helpful snapshot to take a look and say like, oh, we didn't really hit too many K, or, you know, or we did a lot in B. Maybe B is really important. And I'm sure it is, but it's just helpful to say, as you think about the recommendations for next year or this coming year, are there any areas that we need to focus on a little bit more if they didn't get a lot in the previous year?
Yes, thank you, Ms. Rodriguez. Orienting the committee, I think A, G, and J are our primary ones. Did I make that up?
Chair, oh yeah, A, G, and J. I was gonna say, I cannot remember, so I'd have to go back, but it's on the slide, so yes.
Helpful. Fantastic. Any reflections from looking at the summary table from my colleagues on the committee?
Chair Johnson, Eric Schoen.
Good morning, Mr. Schoen.
Hey, good morning. So I think it's worth noting that I think we did some really excellent work last week. Last week. Sure, last week. I meant to say last year. In the prevention subcommittee, as reflected in the rankings of the different recommendations, where 3 of the top 5 were from the prevention subcommittee, and half of the top 10 were from the prevention subcommittee. What we may think we toil in isolation, and it may not have resonance for what people are doing. And sometimes I think for folks on the prevention side of things, there's sometimes it is sort of like, I don't know, a feeling like maybe it's not as important as what the treatment side does, as sophisticated. And I would argue it's just as sophisticated and just as important. And I think the proof in that concept is reflected in the rankings that we've provided. So what it makes me think that we're not done yet in terms of these 2023 rankings. Now is the time, and I brought this up in the last meeting of this general SURG committee, to make sure people are aware of these, because, for example, our policy boards are actively looking for policy recommendations to pursue next year. Our next year's recommendations will be probably just a little bit too late for next legislative session in terms of really informing the bills that are coming out. So whatever we can do to get these recommendations in front of those policy boards and others who are trying to find good, solid policy recommendations, I think we still need to be thinking about how we do that.
Yeah, thank you for that comment, Mr. Schoen. I appreciate that. And I know Dr. Kearns, who may or may not be on this call today, has done a lot of work to distribute these recommendations to a variety of audiences. I know that she presented at the Clark Policy Board, and I believe has just sent these out to a number of different groups across the state. But I do think that getting the recommendations out to other groups that can move the policy through is very important.
She's also on the agenda for the April Northern Nevada Behavioral Health Policy Board meeting.
Fantastic. Thank you for sharing that.
Mm-hmm.
And Chair Johnson, can I add a comment?
Please, Ms. Rodriguez.
I wanted to note that this exact topic that Mr. Schoen brought up will be on the agenda for the April 10th SURG meeting on report distribution and getting recommendations in front of the behavioral health policy boards, as well as, I believe, the joint interim health committee. So there will be further discussion with the entire SURG on that, both to discuss where it's already been presented and to plan for additional outreach.
Thank you, Ms. Rodriguez. Any other comments on the summary table prepared here? My just reflections as, oh, sorry. As
Did you
the
want me to
chair,
move to the next slide or just stay on this one?
just this one, just briefly, that are opportunities to look at if L is a cross-cutting item, I think that we can step into to looking at that. That's for response subcommittee. Never mind. And maybe H and looking through G as well as we consider the next year's rankings if we establish any new areas or new priority opportunities. Next slide, please, Ms. Rodriguez. And thank you for preparing this one as well. Do you want to talk through walk folks through how to read this table as well, Ms. Rodriguez?
Sure. So this is also based off of the 2023 recommendations. And this is when somebody submitted the whatever recommendation they put forward. As we just reviewed on the survey, you check who, if there's any special populations that would be particularly impacted. So this, it's in the same order as the last slide with the subcommittee and the recommendation. And it's also to help us see, you know, if there are certain populations that aren't getting, it looks, well, I'll let you all decide how spread out it looks, but it's just to give the SURG an overview of that, of the special populations.
Thank you for that. Any reflections on reviewing this table from my colleagues on the committee?
Chair Johnson, Eric Schoen for the record. I would just share an observation that I shared with the statewide coalition, Resilient 8 and Formidable 14 monthly call yesterday about a visit to Washington, D.C., where we had several hundred other grantees who are doing the same thing across the country. And the work oftentimes feels messy and it feels scattershot. I think that's kind of the nature of the work. There's so many populations that we're trying to reach, and they all require slightly different strategies and ways of engaging. And I think that could be a helpful frame for somebody who might think this is so overwhelming. There's so many different things, but it's all connected with how do we find platforms that reach, say, seniors or versus youth on the other end of the spectrum, or family members who've lost somebody, or folks who are in active recovery. They're all in slightly, or in some cases, dramatically different places. How do we reach them with these different strategies? And then how do we make sure they're kind of working in concert to amplify the beneficial effects of each? Does that make sense?
Yeah. Are you, sorry. Whoops.
I'm so sorry, Debbie Nadler, for the record, I can't raise my hand. Eric, that is so imperative and so important. I just noticed there's something missing from here, and maybe it is, and I'm not reading this, but under where it says people who inject drugs as revised, there's a whole population we're missing in these recommendations, unless I'm not seeing it. But it's the people who are socially using drugs, because this is what we're losing now. If y'all have seen across the country, I've known more people who've lost their lives from cocaine this year, being, you know, obviously with fentanyl or mixing cocaine and I forget what you call it, a hot shot or something like that. We've got so many kids who are not even suffering from substance use and who are using right now and who are dying. And I'm not seeing really, I mean, I see it says youth, but it's not just youth. I mean, my cousin who died was 32. I guess that's youth for a lot of us, but for younger kids, it's not youth. I mean, I feel like there's something missing from here.
Yeah, thank you, Debbie, for your comment, and thank you, Eric, for your reflection. One, I do think the opportunities to synergistically look at these recommendations and how they broadly impact multiple populations. And my understanding of the groups across the top here, and Ms. Rodriguez, hop in if I'm incorrect, is that these are the ones that are specifically named in the AB 374 legislation. And the last one does speak to other populations that are impacted by substance use disorders. So I believe this is a reflection of ensuring that we're adhering to the populations outlined in the legislation, not a priority of certain groups over others as we adapt to the ever-changing landscape to address overdose prevention and engagement. Hopefully that helps as folks are looking at this table.
Yeah,
Chair
but I'm sorry to ask again. The legislation that included these was passed. Was it this past year or the one that was 2 years prior? Because it's definitely, we all know it's changed dramatically. And I feel like we're missing stuff. I'm sorry. That's all.
Thank you for elevating that, Debbie. I think if this committee, when we think about recommendations, wants to entertain additional special populations across the SURG as a recommendation, that could be something that we may consider filling out that survey and discussing as part of this work. Go ahead, Ms. Rodriguez.
Thank you.
Yeah, thank you, Chair Johnson. I just wanted to answer Ms. Nadler's question. The legislation was passed in 2021. And as Chair Johnson noted, on the survey, you could check this last box, the other populations overly impacted. And you could specify what that population is, if you wanted to. But as she noted, these all come from the legislation, these special populations. The reason why people who inject drugs, why that says as revised, is because I believe the legislation said intravenous drug users or something like that. And a former SURG member had indicated that that was not the right term to use. So the SURG decided to revise that part, but it still pertains to what the legislation had outlined.
Perfect. Thank you.
Mm-hmm.
Thank you. Any other reflections on this summary table from committee members? All right. Next slide, please, Ms. Rodriguez. Wonderful. So this is an opportunity for us to just, I think, be grounded in the prevention recommendations that we did submit as part of last year. I know Mr. Schoen, in previous meetings, we've wanted to talk about recommendations that we want to carry forward into 2024, revise as needed, and then new ones that we want to add. So I think this is just a reorientation for folks about the recommendations that were submitted last year. Is that correct, Ms. Rodriguez?
Yes.
Wonderful. So you all will recall this committee recommended the multiple entities at the state double the amount of investment in the SAPTA primary prevention programming for ages 0 to 24 and review the funding allocations annually to not be at the expense of existing programming. A second recommendation to expand Medicaid billing opportunities for preventive services to allow blended and braided funding to facilitate services and expand access to care for youth and young adults. The third was to create a bill draft request to amend the NRS for a 15% set aside of tobacco control and prevention funds from the Fund for Healthy Nevada and distributed using a local lead agencies model. Next slide.
And Chair, I wanted to note that I included these harm reduction ones since the prevention subcommittee was the one that really did the legwork on them. So that's why you see this here.
Thank you. Support harm reduction through making a recommendation for utilization of opioid settlement dollars to designate a baseline level of identification and overdose reversal medication for the next 10 years in Nevada to create a stable and sustainable source of overdose reversal medication throughout the state. Implement changes to recruitment, retention, and compensation of health and behavioral health care workers to enhance compensation in alignment with a letter from, I think that is June 22nd, 2022 at this point, or is that 2023?
Yes, that's correct. I should have, we should add that year in. Thank you.
Thanks. And then to sustain and expand investment in community health workers, peer recovery support specialists, and certified prevention specialists. Next slide. This one was a recommendation to create a bill draft request to change Nevada paraphernalia definition as it related to smoking supplies, which we included some proposed draft language in the justification. Establishing a statewide initiative for community drug checking that incorporated multiple parameters. On this slide. Next slide, please. A provision around harm reduction shipping and shipping supplies across the state for people who needed access to harm reduction supplies, particularly in rural Nevada, and increasing advertising about the shipping programs in rural Nevada. And then a bill draft request to equalize peer recovery support specialists so it is equal to or exceeds community health worker reimbursement. Part 5 is creating recommendations to the legislature modeled on Maryland's STOP Act. And then a recommendation to DHHS to create a data dashboard on a regularly updated report on alcohol outlet, tobacco outlet, and cannabis outlet density across the state.
Chair, I believe that's the last slide until the next agenda item.
Thank you. Lots of great work across this subcommittee in the last 2 years, and wanted to just sort of ground everyone as we think about planning for 2024 and where we've been so far in this work. Any comments before we move to the next agenda item?
Chair Johns, for the record, Eric Schoen. I think they still have as much resonance today as we're speaking as they did 2 months ago when we finalized the whole report. I mean, I would, it would make our lives a lot easier. In some ways, I am completely comfortable just sort of copying these and having these be the focus of 2024 and refining them a bit. But again, one of my concerns from when we first started this work is just continuing to generate new recommendations. So there's so many recommendations, nobody knows what to pay attention to. I think we have a responsibility as a committee to keep the spotlight on the ones that we think are the most important or will have the most traction.
Thank you for your comments, Mr. Schoen. With that discussion, I'm actually going to, if that's all right with you all, close agenda item number 5 and move on to agenda item number 6, because this is exactly the discussion that I'm hoping that we'll have. So let's move to agenda item number 6, planning for the 2024 subcommittee meetings. So Mr. Schoen sort of wrapped up our agenda item number 5 with this really well. So I'm hoping to hear from the folks on this committee What would we like to accomplish this year in terms of recommendations? Should we focus, as Mr. Schoen recommended, sort of working to refine and get some additional subject matter experts around last year's recommendations, or on sort of creating some new recommendations? And I'd like us to kind of think from a vision perspective where we want to be by September, when we'll begin to narrow down these for the annual report. So hoping to hear from as many subcommittee members about their vision for this year as possible.
Hey, Chair Johnson, I know that you are normally so courteous to let us go first. Would you like to take first whack at this pinata?
Sure, I'd be happy to. Thank you, Mr. Schoen. So I'm in agreement that with you that I think our first priority should be to address and look through last year's recommendations, focus on as a first priority refinement. We got some feedback from the larger SURG when everybody ranked these recommendations. So perhaps that's a way that we can look through these particular recommendations and see if there are other subject matter experts that could come and speak to opportunities to help us continue to refine these recommendations as an initial priority. And then, but in reference to some of the comments Ms. Nadler has made, I do think that we want to ensure, as we're thinking through the goals of this subcommittee, that we are being current to the ever-changing sort of landscape, particularly around some of those tertiary prevention efforts and focusing on community. So I don't want to lose sight of that, the evolving overdose epidemic. So by September, my vision would be that there would be some recommendations in here that we have really narrowed down, maybe ones that didn't get as much airtime on this committee last year, with some really solid language. And then if there's anything new, that we have the opportunity to have some subject matter experts be able to give us concrete recommendations about what might be available in policy. Open to the committee's comments as well. Thank you.
This is Debbie Nadler for the record. I'm so sorry again, my hand thing isn't working. Yes, I love everything you're saying. Is there somewhere, because I know I believe we picked as number one, I remember Eric had said to increase the amount for preventative education in the classrooms. Did we ever include the mental health aspect of it? Because it's such a dual, do the drugs stem from a mental disorder or vice versa? The mental aspect is so very important, especially when our kids are starting school. I mean, kindergarten on up. I mean, a big change starts small. We have got to get these kids when they're in kindergarten with the coping and learning skills, social and emotional learning. I mean, it's all stemming from childhood. I think mental health is very, very important to add to all this.
Thank you for your comment, Ms. Nadler. So I'm hearing you say a priority for ensuring that that primary prevention investment, maybe there's an opportunity to look at that language and make sure that it's refined. I do know we included age, so we had 0 to 24 on that recommendation from last year, and I believe that many evidence-based primary prevention programming does exactly what you're recommending, which is to focus on that age-appropriate learning, so that it's not necessarily specific to one substance or spotlight of the moment, but to really give young people skills and experiences and coping strategies and resilience across multiple types of risk factors, including mental health, substance use, choices and decision making.
Yeah, exactly. And then the last thing, and I've asked for this for years, just something so simple on the back of all the student ID cards in middle school and high school, a helpline, a number to call. I know they do it in Reno. They do not do it in Las Vegas. We have the highest population, and it's not on their cards. Something so simple as a helpline number for these kids.
Thank you for that, Ms. Nadler. I do think if we can maybe hear from maybe we can make a recommendation of someone who could come share about a strategy for doing that.
Okay, I know Lisa Lee got it done where she lives. I do know that.
Thank you. Thanks, Ms. Nadler. Other subcommittee members, your vision for our 2024 year together?
Chair Johnson, Eric Schoen for the record.
Go ahead, Mr. Schoen.
This may be more than you want to know about the inner life of Mr. Schoen. But when I was in Washington, D.C., I've been going to, they're called reverse site visits. And for those of us who receive these different federal funds, instead of them coming out and doing their visit, we all go back to Washington, D.C. And we have 2 or 3 days of presentations by subject matter experts on addiction, specifically related to opioids, mitigation of opioids, harm, everything from prevention through treatment. And I've now been going 6 years or so. I've been doing this work for almost 30, but in terms of this particular forum, about 6 years. And I have to guard myself from being jaded and being dispirited, because we were making some real progress through, I think, about 2017, 16, 17, 18, against what at that point was primarily a prescription opioid drug problem. Fentanyl hadn't yet really popped, and we were seeing prescription rates drop, and we were seeing harm from prescription drug use drop as well. There was a palpable sense of hope. And then fentanyl, if previous generation of drugs was like having an arsenal of conventional weapons, fentanyl was like a nuclear bomb. It was an order of magnitude, the damage that it has done, an order, and continues to do, an order of magnitude that much bigger. And carbofentanyl is like a hydrogen bomb compared to the nuclear bomb of fentanyl. They're both so super destructive. And I find it's easy for me, as somebody who's been doing this for 30 years, who hope to move the needle, sorry, poor choice of words, who hope to move progress more substantively in 30 years in terms of community building, to see that our numbers are still really concerning in terms of the harm still being done. So I find myself looking for some magic solution, like, hey, we're going to have some sort of drug like the new generation of methadone that will be able to counter the effects of fentanyl and just blunt it, and that will kind of help save us. And guess what? There is no savior like that. Instead, what I hear time and time again, what I need to hear time and time again, is that the hard work of this, what we are doing, of trying to mitigate the harms from opioids, of trying to increase resiliency writ large, community resiliency, family resiliency, school resiliency, student resiliency, all of those populations, is community building and relationship building. The pro-social contact that helps to provide the protective factors and helps to develop the kinds of skills and the kinds of knowledge that people need to have in order to safely navigate and have the tools to safely navigate these currents, if you will, to get to the other side. So I like what I'm hearing, that an emphasis on maybe in terms of vision. What we're looking at is how do we support that community resiliency in our work here in the prevention subcommittee over the next year. And maybe that's our sort of our primary focus, and that way we can address some of those antecedents that Ms. Nadler talked about, mental health, making sure we're supporting robust mental health making sure we're supporting robust school communities that take care of each other and students have easy access to the hotlines and the resources they might need. So those are just some thoughts.
Thank you, Mr. Schoen. Robust vision as always. So I'm hearing refinement and an opportunity to, as we're building, to focus on resiliency, the community building, and the protective factors as prevention. Thank you. Any other committee members have any comments for the 2024 year? All right, I'm hearing none. I know I have a little delay on my end, so sorry for the pregnant pause. I just wanted to bring up, I know we had heard for some additional presentation ideas. I know that we were hoping for a data update to just kind of talk through. Thank you, Ms. Rodriguez, right on schedule. A statewide data update. If I know that they're still working on getting the 2023 numbers, perhaps we could request some preliminary data as that compares across the board from a state perspective. There may also be an opportunity to request some regional data. So Debbie, I know this was your request. I didn't, if you had anything specific that you were looking for as the SEI team reaches out for input.
As far as the regional data, I mean, I just talk to moms in different states, just, you know, just to see what's going on in the different states and everything. I just don't see really good updates in SAMHSA, what is that thing in Atlanta called, the CDC? I mean, I'm not seeing updates. Everything is from last year or 2 years ago. The only thing I'm seeing is we're losing more kids to cocaine laced with fentanyl than I've ever seen. That, you know, here's the $1 billion question. If anybody can answer this, the $1 billion question is, why are these kids reaching out to take a street drug? Kids who are not suffering, why are they reaching out when they know they're playing Russian roulette? That's the $1 billion question. Why are they still reaching out?
Thank you, Debbie, for that. So I'm hearing, just to summarize, if anyone can talk about some of the stimulants with fentanyl that we're seeing or that are maybe being seen in the drug supply, and then a focus on youth. As we think about that, we also had a request for presentation from the Boys and Girls Club on some of their evidence-based youth prevention. So I know, unfortunately, this meeting can't take anything that's put into the chat. So I just wanted to elevate that these were some presenter suggestions for upcoming meetings. I know we're close to time. So if you have any additional suggestions, I'm going to request that you send them to Ms. Rodriguez so that we can get them at our next prevention subcommittee meeting. The prevention meeting dates for this year for anyone attending and those on the call will be May 15th, June 5th, August 7th, September 4th, and November 6th from 3 to 4:30 p.m. Please continue to join us, and a big thank you to the SEI team for getting these meeting dates on our calendars in advance. We'll move on to agenda item number 7, which is a report out for the April 10th SURG meeting. As chair, my plan is to just sort of recap and share a little bit about the vision that we discussed today from our subcommittee for the April 10th meeting. Unless there's anything else specific from this committee that folks want to be sure and highlight.
I think that sounds like a good plan.
Jessica, oh, sorry. Jessica, Debbie Nowther for the record. In the SURG meeting, and I think it was in November, November, December, Attorney General Ford had said we had $500,000 to spend right now on some kind of action. You know, I believe it was a campaign for the, I'm sorry, some kind of, it was a campaign where we were going to talk about,
Debbie, can I help jog your memory? I don't want to interrupt. Were you thinking about the joint task force meeting?
yeah, well, I think it was. Remember, we had 500,000. He was going to vote on it that day, and we had to push it back. And it was something to do with the Good Samaritan law, the billboards, doing some kind of program where we did videos, podcasts. It was a bunch of things, and it was tabled. He was ready to do it.
Yeah, my recollection, and folks on the call, let me know, and we can have staff follow up about this as well. This was an initiative of the joint task force meeting. My recollection is that agenda item was only labeled as for discussion and not for possible action. So we weren't able to take any votes on it at that particular meeting. And I don't know that we have reconvened the joint task force since then.
Is there a way we could present it? Can we present that again for him to do? It's so imperative right now.
Yeah, I am happy to add that to our report out for the SURG meeting, that we did receive a question about the action from the joint task force meeting, and
Okay.
and we'll also have staff just sort of follow up. Maybe they can prepare a status for that April 10th meeting about the items from the joint task force. Ms. Rodriguez, is that something we can work on?
Yes, Chair Johnson, I have noted the question, and we'll reach out to see if we can get an update on that from DHHS.
Thank you. Thank you, Ms. Nedler.
Thank you.
In the interest of time, I'm going to close agenda item number 7 and move on to agenda item number 8, which is our second period of public comment. Again, public comment is limited to 3 minutes per person. Ms. Rodriguez, to comply with NRS, do we need to reread the items on this slide?
No, I believe the second time we don't need to. I see Ms. Bordelove confirming that, which is great. Thank you. So I'm looking right now. I'm not seeing anybody with their hands raised. I can look to see if anybody's unmuted. I'm not seeing anybody, but I'll just pause for a moment. Yes, Chair, I'm not seeing anybody.
All right, wonderful. We'll close this period of public comment and we'll move on to agenda item number 9, which is adjournment. Thank you, everybody, for your participation and engagement today at the Prevention Subcommittee meeting, and for the great work that we've done, and for the attendees who joined us. Have a wonderful rest of your Thursday.
Take care, everybody.
Bye.
Bye.